Hello and welcome to today's episode of Dr. Simone's Mindspace. Today is a topic that affects both male and female partners when it becomes the question of having a family. We have been talking on this podcast with experts and also people going through this process, including me as a professional, but also as a mother of a young son on the topic of fertility. We have currently in our practice Optimal Performance Zurich a focus on fertility, and therefore both male and female partners are addressed in multiple podcasts, as well as in our fertility packages, which we offer to parents to be. And so, what is male infertility? Infertility is a disease of the reproductive system, and I don't really like to call it a disease, but it is a medical condition that can, to a degree, be treated at times. And I will go through the infertility in male in detail here. And if you have questions, of course, don't hesitate to reach out. It can affect a man, a woman, or both. Male infertility means that a man has problems with his reproductive system. It means you cannot start a pregnancy with your female partner. So, of course, what are causes for male infertility? Natural male reproduction depends on several things. You must be able to make a healthy sperm that can fertilize the egg. You have to have an erection and ejaculation so the sperm reaches the egg. Problems with either of these may mean you have infertility. Below are some of the main causes of male infertility. And to be said, often the focus lies on the woman, and male infertility is actually something that is only detected quite late often, because you try for a long time to try and get a family without asking that question, maybe as a first thing, and it doesn't necessarily come naturally to the couple. And obviously it's also involves a lot of stigma, and it is a very difficult position for the man and also for the masculinity of a guy, which all are important aspects. So sperm disorders, problems with making healthy sperm are the most common causes of male infertility. Sperm may be immature, abnormally shaped, or unable to swim. In some cases, you may not have enough sperm, or you may not make any sperm. This is a problem that may be caused by many different conditions, including the following: infections or inflammatory conditions. One example is infection, which is a virus. Hormone or pituitary gland problems, immune problems in which you may have antibodies against your own sperm. Environmental issues, lifestyle factors, including tobacco use, heavy alcohol use, or marijuana. And genetic diseases such as cystic fibrosis or homochromatosis. Structural problems, anything that blocks the genital tract can stop the flow of sperm. This could be a genetic or birth defect. Infection or inflammation from a sexually transmitted disease can also block semen. Other causes include scar tissues from surgeries or twisted or swollen veins in the scrotum. Other factors may also include erectile dysfunction or premature ejaculation, liver or kidney disease, or treatment of seizure disorders are examples of problems that cause infertility. So, who is at risk for male infertility? You may be more likely to have male infertility if you have had the following: past inflammation of prostate or past genital infections, injury or twisted torsion of the testicles, early or late puberty, exposure of genitals to high temperature, such as obviously sitting in a car, or a hernia repair, undescended testicles. You may also be at risk if you take certain prescription medicines. These include medicines for ulcers, psoriasis, depression, and high blood pressure. So, what are the symptoms of male infertility? You may have a male infertility if your female partner has not become pregnant after you have tried for a year. This means a year of regular sex without any birth control. Your healthcare provider will test both you and your partner to find the cause of infertility. So, how is male infertility diagnosed? Your healthcare provider will review your health history and do a physical examination or tests for male infertility, which may include sperm count, blood tests to see your hormonal levels, other tests such as your health in general, your blood vessel structures of your scrotum inside and your testicles, or a testicle biopsy. So, how is male infertility treated, you may want to know. It depends on the cause, of course. And so, fertility help can be artificial insemination or IVF, in vitro fertilization, or ICSI, which is to inject the sperm directly into the egg to fertilize it. Medicine to treat hormonal dysregularities can also be one of the options, or surgery to actually fix the problem of twisted or swollen veins in the scrotum, for example. So, key points about male fertility factors of infertility means that male infertility means it's not able to start a pregnancy. Male infertility can have many causes, as we've already discussed. And next steps, of course, are to visit your healthcare provider to understand what the problem is. So these are sort of a first insight into the topic of male infertility. If you have any further questions, of course, don't hesitate to reach out. I'm happy to answer them as soon as I can. Thank you very much for listening and have a wonderful night. Take care.